The member for Timiskaming Cochrane.
Thank you, Speaker. My question is to the Minister of Health. On March 5th to 7th, Englehart Hospital's emergency room was closed. First time ever in history. So people who don't have access to primary care for that time didn't have access to an emergency room either. Now we hear, and many hospitals are in danger of collapsing because the extra costs they're paying for agency nurses. And while this is happening, at exactly the same time, the government is spending advertising dollars saying how great the healthcare system is. So my question to the Minister of Health, is she the Minister of Health or the Minister of Self-Promotion?
Deputy Premier and Minister of Health to respond.
Gary, now we are investing more in Northern Ontario, particularly as it relates to healthcare, than any other previous government. In fact, our Northern Ontario School of Medicine has an additional 108 seats available for physicians to practice, train, and live in Northern Ontario. And to suggest that the people of Ontario shouldn't know when we do expansions of a Learn and Stay program that is an opportunity for young people to apply to cover their nursing education, their paramedic training in exchange for serving in underserved communities, speaks to how the member opposite is not looking at this in a holistic way. When we expand the scope of practice for pharmacies, ensuring that people can go to their local community pharmacy and get 19 minor ailments treated. We have to educate and inform people so they take use of that service, a service, Speaker, that has had over 800,000 Ontarians use it since we brought it in January.
Supplementary question.
Thank you, Speaker. So this member previously brought forward a bill to stop partisan advertising, what the previous Liberal government was doing, which they are doing now. And I'd like to read a quote. "This issue is a total flip-flop from the Liberal members opposite," Jones said in 2017. What's that line? That was then, this is now. What has changed, Speaker? It appears that the Premier will only maintain those principles when they are convenient. My question is to the Minister of Health. You introduced this bill initially. What happened to those principles?
Remind members to make their comments through the chair. The order. Minister of Health.
Speaker, when we make policy changes that impact the people of Ontario, it is important that we communicate those changes. You know, 2 years ago, we did not have minor ailments available within community pharmacies. That's over 5,000 community pharmacies where people can go and get treated for minor ailments. And that impact, when we communicate those changes, when we ensure that people know for minor ailments, they can go to their local community pharmacy, we see the impact. As I said, 800,000 individual Ontarians have used and accessed that service, a service that was not available prior to January of 2023. So yes, I absolutely will continue to encourage us promoting new policy and new initiatives that impact the people of Ontario. Thank
you. It's the late-night hospital visit close to home. It's knowing that your child is in good hands. It's being there for the things that matter. It's the more than 17,000 new nurses hired in just the past year. It's care when and where you need it. See all the ways we're connecting you to care.